I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Hello, and welcome to this episode of IDD Health Matters. My guest today is Dr. Jonathan Smith. Welcome, Jonathan.
Thank you for having me, Craig. Really excited to be here.
So I'm really excited about what you're doing. And so if you would just talk about what's going on in your life right now.
Yeah, lots of exciting things going on for sure. So I'm really just thrilled to be part of a team under Mercer University's guidance to open a center for adults with really the focus of taking care of the IDD population. And it's something that's not done very commonly throughout many parts of the country. And so it'll be Georgia's first real focused center on that type of care.
So why did Mercer become interested in doing this?
Yeah, so the state of Georgia had it as a priority to make sure that this population is cared for and to really close the disparity that exists. And when they were looking for strategic partners who really had a focus on mission-driven type work, Mercer is already doing a lot of that in communities throughout the state. And so this is a great way for this center to become the way to disseminate a whole bunch of information that is missing in the education process to physicians, therapists, and other providers throughout the state. So not only will we be able to care for the patients themselves, but also be able to educate everybody else on the intricacies of taking care of these population.
Well, everybody who listens to the show knows how much of a proponent I am for educating people about how to provide good health care for people with IDD. So, you're providing, like you said, kind of two things. You're going to help educate clinicians through the clinic because it is part of Mercer, right?
Yep.
And you're also going to be providing needed health care for so many that do have health disparities. Pretty good match there. How did you get involved specifically in this project?
Yeah, so I actually went to Mercer for medical school, graduated, and then pursued training in med-peds, internal medicine and pediatrics training.
Just as a little note here, you went to University of Mississippi Medical Center, yes, which is where I did my family practice residency.
Yes, a Mississippi connection for sure. Yep. Yeah, that's great. Yep. And then afterwards, I had a son that was born with Down syndrome and has IDD. And I realized that there were some things missing in the healthcare system for him. And when this opportunity came, it just felt like it was a perfect match. It's a way for me to really look at the systems that exist and how to build momentum to get patients, just like my son, what they're going to need for their healthcare moving forward. So I think that the IDD population as a whole has a lot of missing parts to the healthcare system. And the earlier we start in that training process for medical students, we know that the things that we instill in them are going to be carried with them throughout their careers. And eventually, some of them are going to become physician, educators themselves and are going to train the next generation. What we need to do is start the domino effect early so that carries on for generations to come.
I could not agree with you more. And people, you mentioned earlier how people with intellectual and developmental disabilities, there are many health disparities that exist, poorer health outcomes, earlier age of death, later diagnosis of cancer, so many different things. And it really does, in my opinion, boil down to education hugely of everyone, of healthcare providers in every level of healthcare. And when we think about training students, we think, well, gosh, that's a long runway before we get a group of clinicians that are really, really trained. But it's certainly what needs to happen, and it's where it needs to be. At the same time, training other clinicians as well too can be helpful. And one of the models that I kind of worked with when I was in Mississippi, when I developed a consultative clinic, the idea was to help clinicians out in practice have a resource, number one, and also resource when they needed some information about how to provide health care to someone that in their practice that they may not be that comfortable with. So there's I guess there's that learning component too. Do you see the clinic maybe serving as a resource as well to clinicians out in communities?
Oh yes, absolutely. So I think a lot of it is really looking at the entire patient and their situation, right? So it's going to be tough for some patients to make it on a regular basis to any primary care office that's further away than a few minutes, right? Mm-hmm. There's transportation, there's caregiver, there's a whole bunch of different considerations that have to be met for that to be successful. So we will certainly care for people that are within the immediate area, and then hope to be able to expand our reach to either through telemedicine or through other types of communication to those communities. So it might be a situation where a patient is able to make it to our office for a consultation type visit, mm-hmm. and then our team will be able to hand off that care back to that community physician, that community therapist, whoever that might be, to continue caring for the patient with the guidance that we've been able to provide.
And growing the clinicians in the community's ability to be able to provide healthcare as well too.
Yeah, exactly. So maybe when the next IDD patient, walks through that clinician's door, that little bit of experience starts to build on itself over time, where the confidence in that person's ability, to care for those individuals really starts to rise.
So I think there's probably going to be a good bit of interest in your clinic.
Yeah, we hope so.
Yeah. What have you seen so far? Have you seen interest?
So yes, there have been quite a few folks that have contacted the state and have expressed interest in learning more about what our model looks like, especially as we really get established. There are only a few places around the country doing something similar to what mm-hmm. we're doing. And to have wonderful state support and great partners, Mercer is poised to be able to help kind of set the standard for some of this, as we get moving forward. The services that we're going to be able to offer all under one roof is really what, an advantage to these patients and their caregivers. So we'll be able to offer primary care and behavioral health services. Some subspecialties will kind of rotate in and out. And then we'll also have therapy services. So, physical, occupational, speech therapy. We have an audiology booth. We have a pharmacy that's actually in-house. We have a dentistry suite, some imaging services with x-ray, mammogram. I mean, it's just really a way that people can come and get all the comprehensive care under one roof. It just breaks down so many barriers, that have existed in the past.
And that comprehensive, coordinated, integrated care it's important for everybody, first of all. All humans can benefit from that model, but especially for people with intellectual and developmental disabilities, because so many things are interrelated. We might have a behavioral health situation that is affecting a medical health situation, or a medical health situation that is appearing as a behavioral or mental health situation, or a dental situation that looks like all of those things put together. So having that integrated team and all of those services available, like you said, in one roof is really important and valuable. And we're beginning to see really good evidence of those types of models actually not only improving healthcare, but lowering healthcare costs for people with intellectual and developmental disabilities as well, which is pretty powerful.
Yeah, absolutely. If we can be in a situation where physicians are right next to each other, helping to talk about the patient and collaborate that care immediately, then it not only solves some of the costs, but it solves the time implications too. Right? We're not waiting a week or two for a consult. We're not waiting a while for a lab or for a therapy service to be able to evaluate somebody. Right? So that amount of time really makes a difference in a patient's experience. Right? Where what could have been a bad experience now is turned into a good one. Right, where they're able to get efficient care. It really turns the table in a good direction.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Well, Dr. Smith, One of the things I always ask guests is to give me 3 things that they think are really important that can move things forward for people with intellectual and developmental disabilities, improve health or wellness or just the world of supports and services. So I'm going to give you the opportunity to share your 3.
Yeah, so I want to say first that I'm also a parent of a child that has Down syndrome and IDD. And so a lot of my experience is informed by what it's taken to get him through some of the systems that exist. And so some of these considerations really are built around what my wife and my family's experiences have been, firsthand experiencing what the system is. So one of the first things I think is the coordination of care between different places. Really, you can hear me talking about that already with our center. I'm excited about it because I think some of that is so hard to achieve in today's world. We get so busy in just different clinical scenarios, trying to find the time to be able to touch base with different physicians or providers in different communities is something that's hard in today's healthcare model as a whole. And so our focus is going to be to change that narrative. So that it will be easier for patients and caregivers and families to see some of those services come to life a little sooner. The other is obtaining some of the insurance products that exist. Sure. So even if the care coordination is correct, it takes us weeks to put together the secondary applications and some of the things that have to be that are required for some of these state programs. It can take months for some people to get on the waiver program, for instance, as adults. And so we've got to find some way to break down the barriers that exist in that system to get people the treatment and the therapy and the things that they need sooner rather than later. So I've given you 2. The third one that we've talked about already, I think I'll just highlight again, is the education system has to be different. So the medical education system hasn't really been predicated on including these important patients into the population that are considered. And so if we can start to integrate those curricular components earlier, it'll really make a difference downstream as medical students are maturing into residencies and careers as physicians, so that these patients aren't something that are seen as anything other than part of the population, just like anybody else.
Well, those are 3 great things: coordination of care, the payer system, maybe reformation or improvement, and of course educating healthcare providers. And it's pretty clear, I think, you're a force to be reckoned with in those areas, and I bet you will make a big impact. And thank you not only for taking the time to talk with me today, but really for the incredible work that you're doing. And I can't wait to see it all come to fruition. If people want to learn more about the clinic, is there a way that they can get in touch with you or a website that you can point them to?
Yes. So we're constructing a website right now that we can hopefully place in the show notes, so that people can get in touch with us and learn more about all of the things that our center has to offer. Okay. And we'll be opening here in just a few short months. And so, really exciting time for us, and look forward to seeing what all we can do.
Great. Look in the show notes. All right. Thanks again.
All right. Thanks.
The IDD Health Matters podcast is a production of Intellectability. Learn more about our health risk reduction tools and training for supporters of people with IDD by visiting replacingrisk.com.